A lot of people out there are making the wrong decision at the wrong times in terms of collecting their Social Security benefits. We're talking retirement benefits, spouse benefits, survivor benefits, even disability benefits, and all the rest of it. So, I'm going to walk through all of that today. We're going to focus on when you should actually file, and I'll throw in, obviously, kind of recommendations on what programs you should look at first. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country. And in my semi-retirement, I'm making sure y'all get everything you earned, and also kind of making sure the Social Security and Medicare and everything is here for the long term. This is a live Q&A as well. Looks like you already got a bunch of questions down there. So I'll go through some tips, tricks, and secrets on making sure you get everything you earn from the Social Security Administration and Medicare. And then I'll open it up and answer any and all of your question as long as I can for about an hour or so. All right, so let's get right into it. Um, so when should you retire? Should it be at 60, 62, 65, 67, 70? Let's go let's go down the numbers here. So 60, that is for survivor benefits. There's a lot of people out there that, hey, I just filed for survivor benefits at 62. And it's like, okay, why didn't you get it 2 years ago? I didn't know you could get survivor benefits at 60. Well, yes, you can. Survivor benefits start at 60. Actually, you can get what's called disabled widows benefits from 50 to 59 years old if you are, as the program implies, a disabled widow. So, disabled widows benefits from 50 to 59 years old, regular surviving spouse benefits on your most recently, your current spouse that just passed away, that starts at 60 years old. If it's a divorced spouse, you had to be married to the person for 10 years or longer. If you were married to someone decades ago and it wasn't 10 years or longer, if you were married to the person when they passed, as long as you were married to that person for 9 months, then you can get benefits on that person's record if you're currently not married or if you remarried after the age of 60. Okay, so that's surviving spouse benefits at 60. The next would be 62. That is early retirement for regular retirement benefits on your own record and spouse benefits. When you take your benefits at 62, every month you take your benefits early from the Social Security Administration, it's reduced every month. So a lot of people think, well, I'll start at my birthday because, whatever no, it's reduced every month. It's not a whole year or your birthday or anything like that. Social Security reduces your benefits every month you take your benefits early, and increases your benefit every month you delay your benefits. Um, all the way until 70 years old. Don't wait past 70 because your benefits no longer increase based on waiting. All right. So 62, that's your earliest you can take it. 65, that is not your full retirement age. That, changed in the 1980s. And as of 2025, people that were born in 1960, it's fully in effect now. And now they're talking about changing it again, raising the retirement age, moving the goalpost. But as of right now, the full retirement age for those born in 1960 and after is 67 years old. Okay. And then at 70 years old, that's when you get the max delayed retirement credit. So basically, if you wait from 67 to 70, you're delaying receiving Social Security benefits for 3 years. Delayed retirement credits, you get 8% per year every year you wait. So from 67 to 70, that's 3 years, 24%. So if your benefit amount is, let's say, $1,000, if you wait until 70 to collect those benefits, then you'll get $1,240. Okay. All right. So, but don't wait past 70 because those delayed retirement credits stop the month you turn 70 years old. Please share this information, subscribe and like and uh, sub- share and all that kind of YouTube type stuff. Because there's so many people, I'm really frustrated. People, hey, I'm 73 years old. When should I start my benefits? I'm like 3 years ago. I'm 62. When should I start my survivor benefits? 2 years ago. So there's so many people out there making the incorrect information decision because they don't have the information. So you can help out people around you by sharing, subscribing, and liking, and all that kind of good stuff. All right. One thing that is 65, even though it's not the full retirement age anymore, that is when you have to sign up for Medicare. Medicare is mandatory. Scare quotes there, mandatory. If you don't sign up for it, you have to pay a 10% penalty for every 12 months you did not sign up for Medicare. That also includes the Part D, the drug plan. You have to sign up for that at 65. If you don't, you get a 1% penalty for every month you do not sign up for Part D when you're supposed to. There is an exception, just like everything with Social Security, there's exceptions, the exceptions, the exceptions. And that exception is if you have current health insurance from current work, not COBRA or the Affordable Care Act or retirement plan or VA or whatever the case may be. It has to be through current work, yours or your spouse's current work, and your group health plan has to have 20 or more employees. If that's the case, you do not have to sign up for Part B or Part D. You can delay that. So when you stop working, you or your spouse stop working at 70 years old or 80 years old and stop receiving health insurance from current work, then you have to sign up for Part B and Part D, and to avoid that penalty. And then you have to start figuring out, how to cover all the gaps because there's a lot of gaps in original Medicare and Part A and B, and that's why people either get a Medicare supplement plan or Medicare Advantage plan. I'll teach you a trick how to get the best out of that here in a little bit. Okay, so all right, so now that we've talked about the different times in your life that you can collect benefits 60, 62, 65, 67, or 70. Let's talk about your particular situation. And nobody can tell you when you should start your Social Security benefits. Nobody, unless they talk to you and ask you a bunch of questions. So there's a bunch of people on social media says you're stupid if you sign up you're stupid if you sign up at 62, or you're stupid if you don't sign up at 62, and it's just the people that make those videos are kind of stupid. But anyway, because they don't know. Maybe it's their particular situation that they should wait till 67. But let's talk about yours. All right. So here's the questions you have to ask yourself on whether you should start your benefits at 62, 65, or 70. Number one, do you need the money? So if you're 62 and you need the money, then okay, that's a slam dunk. You don't need to go any further. You need the money. But if you're working and you're 62, if you're working and you're under your full retirement age, there's a limit to the amount of money you can make. Next year in 2025, the limit is $23,400. So anything over $23,400, Social Security is going to hold back $1 for every $2 you go over. So if you're making, $10,000 over, then they're going to hold back $5,000 worth of checks. So let's say you get $2,000 a month, they're going to hold back 3 checks. And you're like, wow, that's $6,000. They can't hold back a partial check. So they'll hold back those 3 checks. But there's also what a lot of people miss, and particularly this time of year. When I worked at Social Security, I'd take, hundreds of thousands of retirement applications, and this is the busiest time of the year, November, December, because people want to start their benefits in January, usually because they don't know they can start it early. Because the first year you start your benefits, then Social Security can use a monthly earnings limit, monthly earnings test. So basically, let's say it's July and you want to start your benefits in July, but you say, well, I'm over the $23,400, so I guess I can't start it. So I have to wait till next year. No, that's why people wait till the end of the year, because they don't know. Social Security doesn't care what you made before you start your Social Security benefits. If you made $1 billion between January and June, Social Security doesn't care. Starting July, when you start your benefits, that's when they look at it. So starting for next year, it goes to the monthly, $1,950. Where they come that? 23,400 divided by 12. So the first month you go under $1,950, you can start your benefits. So you just have to stay under $1,950 for the rest of the year, and then you're good. You can start your benefits. They don't care what happens before that. And then the following year, then you just have to stay on the annual earnings limit. They can only use that monthly earnings limit one time. So, um, so if you need the money and you're working, or you're working and making under the limits, or you're working and you're going to stop, then that's a slam dunk. You don't need to go any further in the list. Another consideration is auxiliaries. What are auxiliaries? Those are other people that are waiting for benefits on your record. So if you have children under the age of 18, or children that became disabled before the age of 22, they could conceivably get benefits on your record. And you're like, well, if I start at 62, I'm going to be reduced by 30%. I should wait till 70 or 67. But then again, you're going to lose all of those years of benefits that your children or your spouse could receive, your current spouse. So you have to take into consideration the loss of those checks, children, disabled children, or spouses. Um, and then you have to look at your health. Are you healthy? You have to look at your genes. Genes are great. It's like my grandfather lived till 80, 90 years old. Everybody lives to 100 years old in your family. Then it might be a good idea to delay to get those higher benefits, or start early and get more benefits. So those are the kind of the considerations you need to take into account. And then taxes. If you have other kind of income coming in, you're working. If you're full retirement age and working, once you hit your full retirement age, you can make $1 billion a month, and Social Security doesn't withhold back anything. And a lot of people ask about, okay, do I always pay FICA? Yeah, unless you're rich and you don't have to pay taxes. But anyway, but yes, you also always have to pay FICA if you're 80 years old and you're already collecting Social Security benefits and you're working. You have to pay FICA tax, the FICA, Social Security, and Medicare tax. And but Social Security looks at that. If you're 80 years old and you're working, and it's one of your high 35 years of earnings, because that's how Social Security determines your benefit amount, by your high 35 years of earnings. So if you're 80 years old and you just worked a year, and that's one of your high 35 years of earnings, what happens is you do your taxes with your buddies at the IRS. Okay, they're not your buddies. And they notify Social Security how much you paid into FICA. And then Social Security looks at it and says, oh, okay, is this one of this person's high 35 years? Oh, yeah, it's one of the high 35 years. They kick out the low one, stick in the new one, recalculate, and you get an increase of benefits. That's 100% automatic. You don't have to do anything. But that usually takes a little bit of time to do the COLA, because COLA, it's already, out in October. So get the COLA increase, that starts in January, no problem. To do the increase based on the high 35 years of earnings, the new high 35, that takes a while, because you have to file your taxes and notify the IRS, and the IRS notifies Social Security, and the Social Security antiquated computer system does the calculation. So, sometimes people don't get that increase until, August, September, October and stuff, but they will give you that retroactive pay. So if your benefits increased, $10 a month, and they did that calculation in October, then they will pay you that extra $10 a month going all the way back to January. 100% automatic. You don't have to do anything. So, but if getting extra Social Security benefits is going to put you in a higher tax bracket, and it kind of defeats the purpose of getting that extra check, then that's another consideration you need to check out. If you're an awesome investor and you're like, well, I don't really need the money, but if I got that check in right now, I could make a whole bunch more money on it. If I invested it in this, that, and Bitcoin, or, take it to Vegas or whatever. Yeah. Anyway. And a new one, I've never really talked about this one because I'm, old Marine Corps sergeant, kind of gung ho, optimistic. I've been saying for decades, Social Security is still going to be around. Don't worry about it. But I've been saying that for, a couple of decades. And I thought over the last few decades, the politicians would finally fix Social Security so we wouldn't get cuts here soon. And what are we talking about? Cuts is, let me pop up. So this is what we're voting for. If nothing is done, I put the Social Security trustees report in the description down below. You can check yourself. If nothing is done, then we're looking at cuts of about 2034, about 21%. If the next administration does some of the things they're talking about, there are going to be more cuts. It's not going to happen during the next administration. It'll happen during the next one. And we're looking at about 33% cuts across the board. People always say, well, I'm collecting benefits, so I should be grandfathered in. You don't know. There's never been cuts like this since 1935, when Social Security was started. There's never been cuts. So nobody knows whether everybody's check is going to get cut or only new people or whatever the case may be. But something needs to be done. If we do something, then there are going to be zero cuts in the future, and Social Security is going to be around here for decades and decades into the future. And hopefully, that's one of my other mission is to kind of push. One thing I will throw out there real quick: I put a petition in the chat there. To improve the customer service in your local Social Security office, because people are getting cuts right now because they can't access. Social Security just moved to a reservation only system. It's like having to go to a five-star restaurant. You have to get a reservation months in advance. Well, that's what politicians have now forcing you to do in terms of Social Security. So sign the petition. I've got it in the description and also put it in the chat. I'll put it a few more times in the chat. If you go in there and sign, I guess people were the online website that I use to do the petition. A lot of people use that website for the petition. Sometimes it asks for a donation to. It doesn't come to me or anything. I guess the company uses it to, send out the petition to more people, so more people sign it. You can give it, a few dollars if you want, but if you don't, you don't have to. So it doesn't matter. So politics, you need to take that into consideration in terms of, okay, if I delay till 70, will I just be delaying and get a 21% or 33% cut? So maybe I should go ahead and take it now. That's one. I'm still trying to be optimistic. I hope that they're not cuts going forward, but yeah, I've never talked about that in the future, but I've never talked about that in the past, but I don't know. It's not the next administration. It's the current administration's fault. It's the next one because the next administration was, in charge for 4 years. And so it's Trump's fault. It's Biden's fault. It's Trump's fault again. It's Bush's. It's Papa Bush's. It's Clinton's. It's Obama's. It's Obama's again. It's Clinton again. It goes all the way back for decades, and it's all Congress's and senators' fault. And yes, there's more blame and it's our fault for pushing our politicians to solve it. They keep kicking the can down the road, and there's no more road to kick down. So unfortunately, we're at a crossroads here. We need to decide what we want to do. Okay, let's go ahead and open it up to questions. So if you need help, if you're getting close to 65 years old and you need help, 11,000 people are turning 65 every day. It's the silver tsunami. So you need to sign up for Part A. Part B. Part A covers the hospital. Part B covers your doctors. Next year, Part B is $185, and there's a bunch of gaps in there. The big gap is with Part B, there's a 20% co-insurance. And I don't think there should be a 20% co-insurance. There's terrible reasons why it was started in the first place in the 1960s, but that's the system we have. And you need to cover those gaps. And there's couple of ways you can do it. You can get a Medicare supplement plan, which I always, always, always recommend looking at a Medicare supplement first. So if you're going to be new to Part A and B when you turn 65, or you're new because you just stopped working at 75, please check out Medicare supplement plan N or G. Those are the ones that 99% of people get right now. And see if it's right for you. And if it's not right for you, then go to the next option, a Medicare Advantage plan. And those are specific to your particular area. And you look at your doctors and your prescriptions and any other dental or anything you type of need, but go down the list, check out the difference between Medicare supplement N and G. And then if it's not right for you, then go to a Medicare Advantage. And Chapter will help you out there. And they are licensed and contracted nationwide. Their help is 100% free. And they're doing an awesome job helping you all out. So reach out to them and they'll help you out as well. All right, let's get into some questions here. Vince, I am on SSI. I called Social Security and they said I could buy any price car I want as long as I only have one. My question is, can I get a car loan from a bank? Yeah, yep, no issues whatsoever. Yep. If you're on SSI, the supplemental security income, that's the welfare based, low income, low resources. Um, the max you can get from SSI this year is $943. Next year, it's $967. And one car and your home is exempt. So you could have a Ferrari and $1 million mansion, and they're exempt. It's, people have to get to the hospital and they have to get to, they have to have someplace to live. So those two are exempt. So, yep, a bank loan or anything like that is not an issue. Um, all right, thank you, Take and Took. My question: receives 60% of my late wife's county pension for life. My late wife also received her retirement at 62. I was 57 when she passed. Now I'm 61 and a half years at advice. Yeah, if you want to go ahead and you have to, so your late wife, so you survivor benefits. You can check out survivor benefits, but if your late wife was receiving a county pension, did they pay into Social Security? So she received 1,100. So she received 11. So she probably she was one of the windfall elimination provision, one of the state local agencies, government agencies that didn't pay into Social Security. It sounds like I'm reading between the lines here. But her benefit has already been recalculated based on her non-covered pension. But there is no other recalculation based on yours, unless you worked for a place that didn't pay into Social Security. So yeah, you could have started receiving those survivor benefits at 60 years old. But remember, working anything over $23,400 will, they're going to hold back money. But yeah, I would definitely check it out. If you're not working or you're making around that amount, then I would check it out and say, hey, um, if I start survivor benefits now on your late wife's record, how much will it be? And then ask the next question is, what if I wait a year? What if I start those benefits next year? And that way there's what's called a widow's limb. You can kind of check out to see if your benefits actually increase. And that way they'll give you the number for this month and the number for, next year at the same time. And then you don't touch yours, again, you need to check out the numbers, whatever's specific for you. You don't touch your benefit amount, and your benefit amount will continue to increase until you hit 70 years old. So you collect survivor benefits for a while, and then when your benefits get to be more, then you switch over onto your own. So, um, if my wife gets half my disability and for whatever reason I am kicked off the program, does she go back down to her original lower amount of Social Security? Um, yeah, if she's getting a spouse, if you're 62, then she just gets regular, the she gets up to 50% based on her age. But if you are below your 62, if you're under 62 receiving disability and you stop receiving disability, then yes. Thanks that I was told I could buy any car I want. Okay, yep, already answered that. Let's see. My husband is on disability at 60. When can he apply for spousal benefits when I am 65? You have to file. So that's your current husband. So you have to file, you have to be receiving benefits. And then as soon as he is 62, he can file for benefits on your record. Can someone claim spousal benefits from any of multiple marriages lasting 10 years or more? Yes, absolutely. So what happens when you go into Social Security Administration, you have to file for benefits on your own record if, we're talking, um, you know, other than survivor. So if the person is out there alive and kicking, then uh, I've done this hundreds of thousands of times. The Social Security employee asks you, were you married to anybody for 10 years or longer, or that ended in death? And if you say, yes, I was married to three people for 10 years or longer, then the Social Security employee will go down each one of those and see which is the most money. They'll start your benefits and then get you more money on that other record, whichever one is the highest. So. What do you think of the White House's bill, Medicare and Social Security Fair Share Act? I am confused with removing FICA cap over 400,000. What about the hundred? Yeah, that range there. Otherwise, sounds good. Yeah, that is the Yeah, I think those you're talking about two different things. The Fair Share Act. Okay. I think that's a might have been a different one. The big one in the news. I'm going to do a new series, probably got on a weekly basis. I'm going to talk about what's in the news for all things Social Security and Medicare. Um, but there's a new one on there that's trying to get rid of the windfall elimination provision and the GPO. That's because people just don't understand. Even politicians don't understand it. But to remove the FICA cap, that is the solution that I would recommend. And a lot of people don't know what that means. Basically, there's a cap. People, what? There's a cap? Yes, there's a cap. You and me and 99% of the people out there watching right now, you pay FICA Social Security, because when you pay FICA out of your check, it's, part of that is Social Security and part of that is Medicare. The Medicare, the Social Security part is 6.2%. So you pay 6.2% on every dollar you make, up to $176,100 next year. After that, you don't pay into Social Security FICA anymore. So if you're out there and you make about $50,000, then you pay 6.2% of everything into Social Security, FICA, and your employer pays the other 6.2%. If you make $5 million, because you don't pay FICA after $176,100, you're essentially paying 0.44% of your income is going to Social Security. And that's the issue, because when they started the trust fund in the early 1980s, 90% of income paid into FICA. Now it's about 81%. And that 9% is why the trust fund is disappearing and we're having this future cuts. And if that cap was raised, eliminated, then that would solve 73% of the problem. And I've got the stats. You can check out the Social Security actuary report in the description down below, so you know that's just not me, babbling. Well, it is me babbling, but anyway, there is a reference in down below. So that would get rid of 73%. And the politicians, what they do is they say, well, it's not going to solve everything. We could just tax and it's going to, it's not going to solve. We're going to tax the rich people. And it's like, well, okay, we'll make a deal with you. We've had to pay FICA tax on every dollar we've made for the past 50 years. So to make it even, we'll tax everybody for the next 50 years, and then we'll do something different in the future. But since it's been unfair for the last 50 years. In the next 50 years, we'll do it where everybody gets taxed on FICA. But if you believe that's not fair, then okay, well, let's just go ahead and balance it over the timeline. So yeah, politicians are like, well, it's not going to solve everything. It's not going to be 100%. Well, there's other options as well. But they make the perfect the enemy of the good. It's not going to get Ed's hair back if we do that. Well, no, yeah, that train has already left the station a long time ago. So, anyway, but yeah, I'm going to do. I'll check that one out. I'll see that. Oh, and so your question is, what about that gap? That they would say, okay, from 170,000 to 400,000, they're not going to raise the FICA cap. I think that's more of a political type thing. I've you know, uh, it has to make through the House of Representatives, it has to make through the Senate and stuff. So they don't want to raise taxes on middle income earners and stuff. So yeah, I think that's more of a political type stuff. But um, yeah, it's it'll solve less of a percentage of what's needed. But again, there's dozens and dozens and dozens of other options to fix Social Security without having to cut our benefits by 21% or 33% or whatever the case may be. But I'll check that out one and I'll add that to the I'll look at that a little bit closer. And because that's the same one that President Biden was talking about, that there's going to be that gap, that donut hole that you don't have to pay the extra FICA. So it's probably the same exact thing, but the devil's always in the details, as they say. Hey, Doc, can I get survivor benefits at 60 if I am remarried? Was married to my ex for about 3 years, but he had a child during that time. Okay, so if you were married to your ex, but you had to be married to that person when they passed away, at least 9 months, and you have to be remarried now, and that marriage had to take place after you're 60 years old. So if those are correct, then yes. Pamela, thank you for your knowledge. I'm a teacher in a state that does allow teachers to get Social Security. My question is, if the Congress passes that bill that people like me can get Social Security, would um, okay? Then the question, um, get benefits at 62. Um, so you're in a state that pays into Social Security. Yeah, if you're in a state that pays Social Security, you're one of the 97% of people, workers out there that pay into Social Security. There's only about 3 or 4% that of state and local workers, city workers, that their systems have opted out of paying into Social Security, and that's the one, the windfall elimination provision and everything's talking about. But if you pay into Social Security, yeah, you're like the 97% of us that no issues. I am receiving survivor benefits. I am 60. If I take my early pension, does that count as income toward the 23,000 limit? No, a pension does not count as income. It's only W-2 wages and net income from a business if you have one. Jackie, I'd like to thank you so much. I called Chapter and was helped to replace my devalued Advantage plan. I have learned much from you. Thank you. Oh, awesome. Good deal. Yeah, Chapter is doing an awesome job. They were having a tough time keeping up because what is it? Close to 1.8 million people have had their Medicare Advantage plans canceled for 2025 because the health insurance companies, kind of I guess the board of directors and the number crunchers looked and say, well, we're not making any money over here, so let's cancel all those. We're not making any money over here, so let's cancel all those and let them fend for themselves. So, and then they downgraded a lot of plans too. So, yeah, Jackie reached out to Chapter and they're doing a great job. But yeah, they were having a hard time keeping up. But luckily they were helped to help you out. Awesome. Does Social Security count my income of $100,000 if my husband wants to file for Social Security next year, or is the income limit of 23,000 only based on my husband's? It's only based on his income, so it's not a family income. So if he's under the 23,400, then it's his check will continue. Can I collect widow's benefits as well as my benefits? I'm 68. You can collect whichever's higher. So if you're currently receiving benefits on your own record, just your own work record, and you just found out that you can collect widow's benefits, then absolutely, reach out. There is um, if for instance, if you're collecting, if you want to collect survivor benefits, divorce, spouse benefit, you were married to the person for at least 10 years and you just found out that that person passed away, um, and it's been like 2 years since you found out that person has passed away, you can actually request Social Security to give you their retroactive payments. A lot of most people don't know about that. A lot of Social Security employees don't know about that, but always ask for as much retroactive payments, back pay as possible, because yeah, it's your money. You're entitled to it. You earned it. I read that delayed retirement credits earned before you filed are calculated and then applied to your check in January if you file in July. Do you get back pay for the 6 months between July and December in January 2025? Check. Good. Yeah. Wow. You've done your research. Yes, that is correct. So you get delayed retirement credits if it's a full year. It's just because the Social Security computer system is kind of strange and there's different variations they have to take into account. Um, but if you wait in a full calendar year, you get the check immediately. You get the increase, the delayed retirement credits, easy. Um, but if you got partial months that year, it takes the computer system a while to catch up. And yes, you get it in January, and it takes into account all the months, and then you just get a bigger check in January, February. Yes, but you'll get the benefits. It's just I always warn people about that. Is that the first check will be a little bit less than what you think, and then you'll be surprised when you get some extra money in January or so. So, yep, you are correct. I am 66 and 8 months, April 1st, but am going to continue working. Can I draw Social Security January 1st? Yeah, you can make your sound like you're past your full retirement age, and um, yeah, you can collect Social Security benefits. Okay, okay, wait, let me get this right. You're 66 and 8 months. Okay, in April, but you're going to continue working. So you're going to be your full retirement age next year. So in January, February, March, you can make over $60,000, $62,160. And then starting in April, you can make $1 billion a month and it doesn't affect Social Security anymore. So yeah, you can collect in January as long as you stay under the $62,160 in those first 3 months. Yep. I pay $600 for me and a dependent spouse to Independent Health HMO group plan with Medicare and copays on prescription drugs and copay for mental health and outpatient. Does it sound right? Wow. It's definitely not a Medicare Advantage plan. A lot of those are zero premiums. It's a pay as you go type system. So watch out. Zero premiums. There's always you need to check it out. For independent, yeah, that sounds with Medicare and copays. Sounds like maybe a Medicare supplement plan. Yeah, it really depends on your particular area. If you're in New York, Medicare supplement plans are expensive. Um, that's because New York does it right. But anyway, but I would. It really depends on your particular situation. Yeah, I couldn't tell you based on that. You can reach out to Chapter, and they'll see if yeah, you're paying too much. Absolutely. Titus's mom. Hey, long time no see. How you doing? My Medicare medical from OPM retirement has coverage for medicine pharmacy. Are you saying I still have to sign up for Part D at 65? No, usually that's the OPM federal employee health benefits. That is credible coverage. There was a little debate about that a few months ago, but they finally resolved that. So you should be good. Just reach out to your HR OPM and say, hey, is my plan credible? Or reach out to your health insurance company, whichever one you chose, and say, "Hey, is this plan credible for Part D?" And I'm sure there's a 99% chance I say, "Yeah, of course it is." So I'm sure it is, but it doesn't hurt to double check. So when a spouse uses the split strategy before their full retirement age, is it just their portion that is reduced and their spousal benefit portion difference is paid in full? Yes. So you're looking at the split strategy. What he's talking about is current spouses, you have the lower income earning, so the lower benefit, goes ahead and files as soon as possible. Again, work limitations, but files as soon as possible. And then the higher earning spouse waits till later. So the lower earning spouse, let's say, start at 62, that means they're going to have, about a 30% reduction. But when the higher earning spouse collects, then the other spouse's benefit is based on how old they are when they start the benefits on their others. So if you collect at 62, for example, you get a 30% reduction. And then if your spouse files and at that time you're your full retirement age, 67, then you'll get exactly 50% of that spouse's benefit. So it's no longer reduced because you reduced. It just made up the difference. So you'll continue to get your check and then you'll get the difference. One offsets the other. So yeah, it's not it- the second one, the spouse benefit is based on when you file for spouse benefits. And that's based on when your spouse files for those benefits. Husband is planning to take Social Security at full retirement age. I qualify under my own work record. Would my spousal benefits be permanently reduced if I collected before my FRA and then transferred to his FRA? Again, okay, I just answered that. So hopefully what I just answered is the same question you had. Very much appreciate you're willing to help understand the system. You're welcome. Thank you. Joan, why is Social Security saying that they pay me $1 more each month when I have been disabled for many, many years? Did pay me $1? Yeah, I'm not sure. Could be the COLA. It could be they round it up. Usually they round down the cents. Maybe they round it up this time because of the COLA or something. So yeah. Helping my brother with insurance. He has a few months until 65. Can Chapter help him prepare now? Absolutely. Yep, they've gone over. They've closed out the annual enrollment period. That was December 7th. So now they have more time to help people. So yeah, absolutely. It's always good to get prepared, and because all of the plans available in your area are already out. So the Medicare supplement plans are out. The Medicare Advantage plans for 2025 are out. So yeah, they can tell you exactly, what's available for next year, all of next year. I'm semi-retired in September, and the company I work for allow me to only make my monthly allowance. Don't remember exactly the amount, but make sure the company you work for will work with you. Yeah, that's always nice to have a company work for you, right? Work with you. If I collect spousal benefits at 67, is that protected benefit then COLA adjusted in the years prior to my draw for? Yeah, COLA is once the Congress comes out with, or not Congress, the Department of Labor Statistics comes out with the COLA, then Social Security automatically multiplies that by 70 million. Well, everybody's. When you go in to get your estimate, that includes the COLA increase as well. So yeah, COLA, you never have to worry about COLA. COLA is 100% automatic. The other part of that question, or is that 50% of the spouse's PIA the first starting figure when I draw at 67? Again, they don't know what the COLA is going to be next year, or excuse me, 2026 or 2027. So the COLA isn't figured in there for those years, but 2025 it is. Hi, Ed. Thanks for your time. Would I still be eligible to receive survivor benefits if I am living with my boyfriend, not married, at the time I apply at 60? I live in the state of Texas. Well, because you live in Texas, you can't collect anything. No, I'm just joking. I went to high school in Paris, Texas. So, um, no, it Social Security only counts a marriage. So if you're not remarried, then you're good. So if you're living with someone, yeah, no relevance whatsoever. Is long term the only way living with someone is it's called holding out. If you're the only time that is taken into consideration is if you are receiving SSI, which is a supplemental security income, which is a welfare-based benefit. And if you're living with your boyfriend, you've been living, and you're not really married, but you're pretending you're almost kind of married, and he's a millionaire or she's a millionaire, then the welfare benefit they kind of look at that. But as of right now, um, you know there are some proposals out there to stop spouse benefits based on income and stuff like that. So yeah, it's hopefully that doesn't pass. But is long-term disability monthly payments considered income, and is it more than the allowed 23,000? No, it's income. For that annual earnings limit is only work, W-2 wages, and net income from self-employment. So that doesn't count as that. That's what they did with me. Kicked out the old and put in the new, and increased my monthly by $10. Awesome, good deal. There you go. So it does happen, completely automatic, and you probably my 10th life. I like it. So probably took until July, August, September, October, and you got the $10, and then they paid you, the $10 a month going back to January. So it's all 100% automatic. It used to be, we used to do those calculations, a lot of those calculations manually in the office. And it was just a matter of, pressing the buttons. And so I think I still got carpal tunnel for doing a million, thousands of those. So, um, if I take my benefits on my full retirement age, still my fund keep accumulating COLA, or I start getting my COLA again. COLA, never worry about COLA. COLA is in there, so it's automatic. COLA is automatic across the board. On the estimates for the future, for your current year, for future years, COLA is COLA is COLA. It's cost of living adjustment. Could you imagine if they didn't give you? So if people that have been receiving benefits for 20 years are getting, the benefit amount in 2000, or people that have been receiving benefits since the 1980s are still getting 1980 rates. Could you imagine that? Yeah, they would talk about a revolution there. So yeah, don't worry about Cola's. Yeah, my husband, age 64, started set up on 1124 Social Security. They asked to start November, December, January each month, $17 more. What month should we start? It really depends on you. Should I do the new laws affect the decision? No, no new laws right now affect that decision whatsoever. I'm keeping an eye on that. But yeah, it's completely up to you. The way, here's the quick ways to do it. Social Security employees used to do this for you in the old days when you actually got into the office and talked to a human being, and you didn't have a reservation at the five-star restaurant called, Social Security, which is terrible. Please sign the petition. Let me put the petition in there again, in the remarks. So please, um, sign that petition, to improve the customer service at your local Social Security office. Um, but oh shoot, where's the question? Uh, I lost the question. Um, But the $17, okay, all right. What we used to do at Social Security is we used to give you kind of run the numbers, the break even point, but it's super, super easy. So if you start your benefits 10 months early, let's say, and you get $1,000 a month, so you get $10,000. And then you divide that by the $17, and you're like, well, I'm going to be losing $17. And then you say, okay, well, how long is it going to take me to make it up? It's almost always 14 or 15 years. So it's really depends on you. Do you want to wait 10 months and get a $17 extra check for the rest of your life? Or if you're going to live to 100, it might be best to wait to get the extra $17. Um, but you're also going to be giving up $10,000 for the checks, and maybe you can, pay off some, interest, or, credit cards or whatever the kind of, stuff like that. So, all right, let's see here. I'm jumping around to here a little bit because we're running out of time. My wife and I are both on SSDI, married for 46 years. Wow, awesome. Congratulations. She is 70. I am 65. Can we apply for any kind of spousal benefits on each other? Thanks so much for what you do. You're welcome. It really depends. So, number one, you're no longer on SSDI. You are on regular Social Security benefits. Your SSDI, she is no longer on SSDI. She is on regular retirement benefits. Your SSDI will end once you hit your full retirement age, so 66 and 8 months, 67. But the check and everything stays the same. Most people don't even know the switch. It's just a bureaucratic thing where they stop taking your money out of the Social Security Disability Trust Fund and start taking out of the regular retirement trust fund. So your check stays the same, direct deposit stays the same, and everything. But because you're no longer receiving disability, there is no more work limitations. So after your full retirement age, you can make $1 billion a month, and Social Security doesn't care. There's no more CDRs, those continuing disability reviews. You don't have to be, oh my gosh, I don't want to go back to work, and people find out I'm not disabled. Well, you're not on disability anymore. You're on regular Social Security. So in terms of spouse benefits, um, you one spouse has to be receiving benefits twice as much as the other. But don't look at your check because that's your monthly benefit amount. That's not the number they look at. They look at what's called the primary insurance amount, the PIA, which is the amount you would have received at your full retirement age. Yours is a little bit easier because you're on disability. So that's basically what you would receive at your full retirement age. Yours is a little bit easier. But if they're kind of close, I would call Social Security, both of you on the phone there, wait the 3 hours to get to be able to talk to a human being. It's terrible. Anyway, and ask them if there's any benefits on either of your record, and they'll be able to look at the PIA in 2 seconds. And if they see any money there, they'll say schedule an appointment sometime within the next years, yeah, and get your benefits. I'm on SSDI, disabled widow, 54 years old. Will they take away my SSDI when I reach retirement age? No. Yep, just talked about that. They will take away your disability once you hit your full retirement age, but because you're no longer on disability, you'll just be regular retirement. You'll still get the same check, but no more work limitations. My ex died almost 2 years ago. I don't know. I don't know. I could file then. Now he had both railroad retirement and VA retirement. Can I get both of them? Yeah, the VA retirement, no issue, no influence on Social Security at all. The railroad is a different beast. Yeah, when Social Security was started, many, many years ago, the railroad already had their own system. There's the ones that, interesting history of the railroad I won't go into because that's a 3 hour lecture. But anyway, I'm a university professor after all. So also, actually, I'm supposed to be grading papers here. But the railroad already had a system. So when FDR started Social Security, they said, hey, don't mess with our system. So if it's a railroad, what happens if anybody that comes into Social Security, I had this myself. If you come into Social Security, the Social Security, you say, hey, railroad, and the Social Security employee has to call the railroad board and find out who has jurisdiction, whether it's Social Security has jurisdiction or retirement has jurisdiction or railroad has jurisdiction. So in your particular case, railroad, you can get VA and railroad. You can get VA and Social Security. It just depends which one, railroad or Social Security, you get. So you probably already know that. If you're if you're already dealing with a railroad, then yeah, you should be good. You should already know that. Ed, my brother, who has been receiving for 4 years every third of the month, for some reason, no funds showed up December 3rd and still no show. Any ideas? Yeah, that's third of the month for some reason. Yeah, it's 10 days past that. I wonder if it's direct deposit or something, or you got one of, what's going on? A mail in the check. Yeah, try to avoid the mail, checking the mail. Um, Then, yeah, number one, Paul, thank you for looking out for your brother. Number two, yeah, you need to call Social Security and find out what's going on. I think because of the low staffing, we're going to see this more and more and more. That's why please shine the petition to improve customer service, because they're going to be making a lot of mistakes because they're way, way understaffed. So call up Social Security and find out what's going on. And if it's just they messed up, something happened, the bank refused the direct deposit for whatever happened, they will tell you what's going on. And if your brother has a check due, then you can go down to the Social Security Administration and demand an immediate payment. But you have to have some type of proof. It's like a 5 day, quit notice from your landlord that if you don't pay, the rent in 5 days, they're going to evict you. You have to have something like that, or that they're going to shut off the electricity or the water or something like that, some type of dire need, and they can give you a check out of the office, an old paper check out of the office. If you don't have something like that, then they'll just run a regular, they'll just rerun the direct deposit. But if he needs the money immediately, he's got to go down there and provide some type of proof if he wants it immediately. And if you get a check out of the office, they usually give you a piece of paper. I've done this tens of thousands of times, because if you take a government check to the bank, they're like, yeah, this is suspicious. Nobody gets a Social Security check. So what happens is the local Social Security office provides you a letter that says, yes, this is a valid check. If you have any questions, call. And I used to put my number down there. And anytime one of my employees gave out one of those paper checks, they'd come to my office and say, "Hey, Ed, just gave out a paper check." And I said, "Okay, I'll wait on the phone here for a couple hours." So I would stay by the phone, and I'd get a call from the bank, and the bank would say, "Is this a valid check?" And I say, "Yeah, it's a valid check." And so, yeah. Yeah, so make sure, kind of inside scoop there, that you're not going to get anywhere on social media on any of that stuff. So please subscribe, like, and yeah, and all that. I turned full retirement age in 2 years and 5 months, and I already decided I'm going back to work full time so I can just live comfortably and with this economy. Yeah, and if you're your full retirement age, you can work and at no relevance whatsoever. And if you work and it's one of your high 35 years, then guess what? That will increase your Social Security benefits, right? Yep. Don, I'm 62 years of age. For every month that I work until the age of 67, I was told I'm getting an extra $10 a month to my full retirement age at 67. Is that correct? I don't know who told you that, but it depends how much you make. It depends how much you make for the entire year. So, and oh, you're probably, not how much you work, but how many that it's not work related. You're talking about you're just delaying benefits. Yes. Okay, that could be correct. Um, every month you wait to collect your Social Security benefits in your particular situation, it increases $10 a month. That other person just talked about increases $17 a month. So, yep, that sounds right. Let's see here. I'm an S corporation and have my own health insurance I provide myself. Am I excluded from Part D? No, you have to sign up for it unless your S corporation has 20 or more employees on your health plan. I didn't get my December payment. I only started in November. I was supposed to provide some kind of documentation from my years working for the DC government, but I forgot. Could that be why? Yes, because they can't determine. So if you work for the DC government and you did not pay into Social Security, then they need that what's called the WEP letter, and the WEP letter is the Windfall Elimination Provision letter that you said you work for a non-covered entity, and the WEP letter has three pieces of information. It says how much your monthly benefit amount from that non-covered entity is, when you were first eligible, and when you were first entitled. And they can't determine your benefit amount until you provide that. So you're not going to get a check until you provide that. Maybe another petition could be fixing the Social Security now with the options to do this. I would sign. Yes, yep. Wanda brought that to my attention. That's the reason I did the first one, and I'm going to do the other one, another petition on what I think. And I've been doing these videos for a while, and I think 99% of people said to solve a majority of the issue, we need to smash the cap so everybody pays the same into Social Security. So yeah, I'll be putting that petition together here. Norma, I think we got like close to 700 signatures on the current petition. So that's awesome. But we just started yesterday. Full retirement age 66 and 8 months, which would be August 2025. When should I start applying online for my benefits? Since I was born the 25th of the month, do I wait until that day? No, you can file for benefits a couple, 3 months before. Um, if you start your benefits in August, you'll get the August check comes at September. But remember, next year, because you're going to be your full retirement age next year, you can actually start your benefits in January. It's going to be reduced, but you'll also get 7 months of checks ahead of the game. So if you're not making over $62,160, in the first 7 months, then I would at least kick it around, call up Social Security and say, hey, if I start my benefits in January, how much is it going to be? And then how much is it going to be in August? And if it's like a $30 difference, I'm like, $30, I'm going to live to $120, and that's $30. A lot of money. Okay, well, wait. But if you're like, okay, if I start in January, it's only going to be $30, but I'm going to get $20,000 ahead of the game, then it might be an idea to start. And if you've already signed up for Medicare at 65, hopefully you did. If you're not receiving health insurance from work, if you already signed up for Medicare, to turn the money on to get the monthly benefits is super, super easy, because you've already done the difficult part of setting yourself in the system and, proving your age and all that kind of good stuff. So, it's really, really easy, because when you're okay for Medicare, when you're about to turn 65 years old, you have to make the decision if you want to sign up for Medicare. Again, health insurance for work and all that. So about 2 or 3 months before you sign up for Medicare, if you're going to go ahead and sign up for Medicare, you have to do that manually, unless you are currently receiving Social Security benefits. If you are receiving Social Security monthly payments, retirement or spouse or survivors or whatever the case may be, and you're about to turn 65, then your Medicare starts automatically. You'll get your Medicare package in the mail about 3 months before you turn 65, and that's automatic. If you have health insurance from current work, yours or your spouse's, 20 or more employees, then you can refuse Part B. There's instructions in the packet to refuse Part B. And the issue is that because of these data brokers out there, everybody knows when you're turning 65. And every health insurance agent in the country, agent and insurance company in the country knows when you turn 65. So they inundate you with calls and emails and junk mail. And what happens is people are tired of the junk mail, and they just start throwing anything away that says Medicare. And a lot of people, unfortunately, throw away their Medicare card. And then a year later, they don't realize they've been paying for Medicare, and they don't need it. They've wasted $185 a month. So be careful there. Don't throw it away. If you don't want it, return it to save yourself $185. If you get it and want it, then there's also a time frame for you to sign up for a Medicare supplement plan, and that's 6 months. There's so many deadlines. It's crazy, and it's such a nightmare to check them all out, to juggle all of the deadlines. But you have 6 months from when you start Part B to sign up for a Medicare supplement. After that, then you just might have to go through health underwriting, depending on your particular state. So yeah, reach out to Chapter, and they know all of those nightmare deadlines that you need to watch out for, and they will help you 100% for free. How are you enjoying your retirement, helping people? God bless you. Oh, thank you. Yeah, I retired for about a week. I suck at retirement, so so I'll get retirement correct one day. But I love doing this, so I will be here as long as possible. My daughter, who is 26, going to apply for disability. She has never worked full time and on and off and part time. Will she be eligible for disability? It really depends on disability. Social Security defines disability as inability to work based on a disability that's going to last 12 months or longer. So she's going to file. She never works, so it sounds like she's going to be filing for SSI disability, Social Security, supplemental security income. If one of her parents is receiving retirement or disability benefits, then she can file for what's called DAC benefits, disabled adult child benefits. I would definitely check those out. So if she was disabled before the age of 22, she can file on one of the parents' records that it's receiving benefits, and then she can receive benefits and for her entire life, up to 50%. And then parent passes away, she'll receive 75% of that person's full benefit amount. So, all right, we are at an hour, and I apologize. I don't have any more time for any questions, but I will be back again tomorrow and answer a whole bunch more.